Table 1 tells me they're ready. So they're the timers. All right, so if you don't have any question, we will take comments from a table 2. So I will start with table 1 since they were the ones that raised their hands first. So I'll go with table 1. Go ahead.
Thank you. So what we talked about at our table with the technology are some of the implications that I'll just say for our learners, for students. Sometimes they're on Facebook or they tweet, but they don't understand sometimes the boundaries of where their messages are going or the implications. I'll give you an example. I mean, something not harmful they will post, and they're trying to take care of a problem. If they use the word victimize or something kind of volatile, then that spreads. And then that has implications, say, at a university level or whatever, but they haven't seen the boundaries or there's no parameters, or they didn't realize that was going to get them in trouble. So that calls to me for strong social media policies within the organization, as well as talking to our learners about personal self versus professional self, because they blend the two. And I'm not sure where they're getting these lessons. You know, it starts clear in junior high, high school. And if you follow, and I don't follow these folks, but, you know, on Twitter, they'll say, I brushed my teeth, I ate a cake. I mean, we don't care about that, but they just post anything, anything. And then when they get in the professional programs, it's a problem.
Yes. Table 3.
Oh, that, okay. Thank you very much. So just following Pam, because we had such a similar conversation, we thought this was a good time to jump in. The question that we posed is, how do we embed digital professionalism and digital ethics within health professions education? Mm-hmm. And as we were talking about it and trying to get a good specific example, the exact example we came up with was, how do we help students learn to either differentiate or understand there is no differentiation between personal self and public and professional self. Mm-hmm. So it was really ironic. We were thinking exactly along those same lines. And I would say that students who are more digital natives today probably don't differentiate between personal and professional and don't realize that there might be ethical dimensions that have to be considered.
Right. Very good comments. Okay, I have 2 hands. I'll go here and then I'll come to you next on 7.
So it's very interesting because we had a similar discussion at our table, but it was maybe at a somewhat higher level. We weren't focused so much on students as on the professions as a whole, mm-hmm. As the users of the technology and as potentially the influencers, that we thought there was a need for a higher level or maybe a restatement of our professionalism, our professional doctrine, our professional mandate in the age of technology that includes the student issues, but really speaks to the whole profession. Mm-hmm. To see that we don't allow the technology to become the determinant, that the values that we hold dear have not been changed, and we need to understand them in the context of an era in which technology gives both, as our very excellent speaker pointed out, opportunity to do good, but opportunity to do bad. Right. And that we need to remind ourselves that our professionalism and our contract with society hasn't changed, and that we need to restate that in the context of a technological era.
That's right. Very great comments.
So I think what I'm going to convey will dovetail with that comment. So the person who coined and popularized the phrase digital native is a gentleman named Mark Prensky. And I was fortunate enough to have lunch with him at a conference with one of my mentors, Kurt Squire, a couple of years ago. And he hasn't abandoned the term digital native. He's sort of taking the stance that, you know, if you're not a digital native by now, you're integrated into society in terms of that diaspora. But he said he now talks about something called digital wisdom. And so what he means, my understanding of what he means by digital wisdom is It is now the role of the people in this room, so that may have been native, who may have been digital immigrants, but who have now assimilated into this digital culture. It is not, so if you had a rotary phone growing up, you're one of these people. But it's now our role to teach digital wisdom to those people who don't have the frame to understand the social mores and professional roles that occurred prior to the digital revolution. And so I think that's something that every time we say digital immigrant, we should start to think in our mind, how can I be digitally wise as I mentor and acculturate students for practice?
Prensky?
Mark Prensky.
P-R-E?
P is in Paul, Prensky, P-R-E-N-S-K-Y, Mark. And I think it's Mark with a C, isn't that right, Dan?
Okay.
Yeah.
All right.
Sorry, Mark, M-A-R-C, Prensky.
All right, thank you. I'll go to table 2.
So I think to piggyback on that, one of the things that I think we're also seeing, though, in the age of digital wisdom is that we have the rise of the internet medical expert. And there's so much information available that people are using Dr. Google to self-diagnose and treat. But beyond that, you also have a rise of people without sufficient background or qualification who cobble together an idea that they like here or there and then put them forward as mainstream care. And I think that being consumers in the digital age of healthcare, we have an obligation to try to help people filter through that information and figure out how to understand what's a quality source and what isn't.
Right. Very good. I'll take one. Okay, here, table 6.
We talked about the notion of the unintended consequences, and that one of the reasons that might happen is maybe the problem solvers aren't defining the problem thoroughly enough. And in some ways, internationally, we've seen that that has to do with not talking to the communities about what you think the problem is, what you think the solution is, and then walking through the possible consequences of that solution. And then I learned a new term in the IT world called the user experience model, which reflects this, right? Yeah.
Great. Any other? Table 8, did you have any question or comments? All right, so Radhika, what do you think?
Sure. So thank you for all of your very insightful and diverse comments, and yet there is a common thread running through. So I really welcome and appreciate them, and for me they are also, it's a good learning because I'm embedded here in the heart of the tech world, and so I'm learning a lot from what you all shared. I have a few reflections. I think on the theme of how we behave online, the professional versus the personal. My sense is that as this term like digital immigrants coming into the world of the digital natives, I think that there is a boundary that is blurring so fast, especially since more and more people are using now, especially for the younger generation, that blur is really kind of getting stronger and stronger, and the distinction isn't there almost. So it might be a hard one to bridge. And while many of us older are trying to keep that divide, for the younger generation, I see that merging very rapidly. And so I think one of the comments made was that I really like that we will have to think of this contract we have with society, and that is my own sense is it's going to be hard to keep that divide between professional and personal, especially with the younger generation. So we might almost have to react collectively as a world community on what is a contract with society. And this is particularly important because a lot of research shows that people behave very differently online than offline, even not just young people, even older people. Certain things, that civility and the way in which we engage with people somehow seems to go away when we engage online. In addition to the points raised, that the terms people use, not realizing how social media amplifies these and what could be the side effects. One thing is, of course, education. I think as I was listening to all of you, the thought that kept coming up is one, educating people deeply around the impacts of what can happen because of the online digital behavior very early on is very important. And the second is just at the basic ethics, right? The professionalism, educating people that try and bring the way you engage with each other, with other human beings when you're online, don't lose that. I think that needs research, because why that happens is hard to know, but that does happen. People are not as civil and as kind of empathetic sometimes when they're communicating on technology. And I think research around that might be very important so that we can bring that back. And then to this point of just reading notes, I was taking notes as you all were talking, the veracity of the source, I think that is a huge problem. I was at a talk yesterday where even all over the world, actually the sources are being doctored and changed, but even where they're not being doctored, all of us, I do it, I'm guilty of it, instead of going to the doctor, just go look up on Google. And people don't realize that. In my case, being from the world of the internet, I look at the source, but I know so many people, my own mother, she tells me I looked up on Google and this is what they said about my health. And when I ask her which site on Google, she hasn't even bothered to look. So there is this for many new digital, the immigrants who are just starting to go digital on the internet, there's somehow this sense that if it's on the internet, it's all valid. And so that education is critical, as, especially for the new digital immigrants, the veracity of the source and the credibility of the source. And I think it's a problem we need to solve in the health. I haven't thought of the healthcare field until the comment here, but it's happening with journalism, it's happening everywhere. And maybe we even need some kind of certificates that in the field, this is a valid source. As I was listening to you, I was thinking that in health, maybe a certificate that this is from a somewhat legitimate source in the healthcare field if it's a query around health. And this was being done earlier where there were certificates for the veracity of the source. Maybe that's needed now in different fields around kind of this is a credible source on health. This is a credible source on water issues if in the research queries. That's the thought that was coming to my mind. And then above all, and for me, I'm a big believer, and that I think the last table's comment really brings to point that including everyone in designing and solving the problems with technology is critical. And technology is also an enabler for collaboration. And now we can, along with the Sustainable Development Goals framework, it can bring people together. Like people who are working on water around the world could use technology the way I'm collaborating, and we're communicating now from within the country, but the two coasts. People could come together and collaborate, and particularly important is involving the people, the users of a solution, having their input in technology solutions is absolutely critical. But above all, I think all of your comments tie back to professionalism, bringing professionalism to how we use technology and teaching people at a very young age. And that is going to be a culture change. I think there's a need for a social movement. And it is something where culturally, I think all of us, each and every one of us will need to start thinking of what is the implication of how we use technology, how we design technology, how we frame policy for technology. But it's going to need a mindset change, which is starting in some pockets, but needs to happen a lot more, is my sense. Emilia, would you like to add some of your thoughts?
Not necessarily. I think we've had a long conversation all day about technology as a means of expanding what we do with students and in clinical settings. And these are issues that we've been mulling in our minds, and it's good to have your views on it coming from Silicon Valley, and I think it's really very valid. So I think we're going to move on to the next section. And then if we have time at the end, we'll continue to engage with you through questions.